everybody, let's go ahead and get started. Let's talk about health. I got a nice little diagram here for you. You see the chart there. It says that health refers to the complete social, physical, and mental well-being of an individual. And I should point out here that all parts of this triangle are equally important. I know that when people talk about health, they are focused primarily on their physical health. However, mental health is equally important. I know that there is a lot of stigma associated with mental health issues, and I believe that is unfortunate because that is preventing people who are struggling with their mental health from receiving help or from seeking help. So be aware that all three criteria must be met in order to check that box of health: mental, social, and physical. I'd also like to mention that health is a social construct, meaning that societies set their own standards for what it means to be healthy, particularly when we talk about life expectancy, which we're going to in a minute. I'll also mention, again, dealing with life expectancy, that the expectations of health change over time, and they change due in part to the technology and social inequality that individuals in a society face. Technology and social inequality greatly impacts a person's health. And yes, I've grown a tail, as you can see. My cat right there decided that she would come and visit me. My cat, by the way, is very healthy, and she's just making sure that I'm healthy too. So don't worry about that. Again, technology and social inequality are greatly impacting a person's health. Poor people are significantly less healthy, and they are more likely to report that they feel less healthy than rich people. If we look at low-income countries, if we look at the health in low-income countries, there are a couple of things that we see. We see that there are relatively short life expectancies. When we talk about life expectancies here in the United States, we're looking at about 77, 78 years of age. But in other low-income countries, we are seeing these shorter life expectancies. Some of these countries across the world, the life expectancy is about 47, 48 years of age. And that's pretty scary, especially when you figure that I'm already 45. That makes me feel like a little bit nervous there. The problem is that many of the people in these countries are dying before they reach their teens. And there are some problems here, and I want you to keep these problems in mind when we talk about problems facing the United States. Particularly in low-income countries, we see poor sanitation, malnutrition, unsafe water, and the lack of medical personnel. And if we look at some of these, and we will in a little bit on a upcoming slide, we will see that many of these same problems impact people that are living in poverty here in the United States. But here in the United States, we are also seeing that by the early 20th century, the death rates from these infectious diseases have fallen sharply. And I've got a chart coming up in a little bit that's going to show you very cheerful topic. It's going to show you how people die now and then, and we're comparing it because today more people are dying from chronic illnesses, and chronic illnesses allow an individual to live longer. However, it is something that is attributed to our lifestyle, and it is slowly killing us or slowly taking away our quality of life. That is a chronic illness. Those are the criteria for a chronic illness. We also see in the United States that for the most part, we have better health than low-income countries. However, we have lower life expectancy than Western Europe. They live on average a few years longer than we do. We'll also mention that we spend more on health per person than any other industrialized country. And this is true if you've ever been to the emergency room. I can tell you from my experience when I was passing a kidney stone a few years ago, I went to the emergency room a few days before. I went to the emergency room the day before Thanksgiving. I spent a few hours in there, and I actually ended up with a bill for about $10,000. If I didn't have insurance, I would have been really I would have been out of luck, because that was a lot of money for for a little 5 millimeter kidney stone. And here's the chart I was promising you, then and now. If we look at 1900, 2016, give or take, this is about right. The influenza and pneumonia was the #1 cause of death in 1900. And we see that that has actually dropped to #8 now. I will mention that people are still dying from influenza. People are still dying from pneumonia, but generally these people are younger, older, or they have a otherwise compromised immune system. Fact of the matter is, influenza is not as, at least here in the United States, not as deadly as it once was because people are taking care of themselves, better care of themselves, and there are advances in technology such as medications to help deal with the flu and pneumonia. The #2 cause in 1900 was tuberculosis. We don't see that anymore. Intestinal disease, heart disease, cerebral hemorrhage, kidney disease, accident, cancer, senility, and finally, diphtheria. Diphtheria is a communicable disease for which you can receive a vaccination. And if anybody out there thinks that vaccinations are a bad thing, I think I should just go ahead and point out that we no longer are dying from diphtheria because of vaccinations. However, what we're dying from now, if you look on this list, when you see heart disease, cancer, stroke, Alzheimer's disease, diabetes, we're seeing things that many people are struggling with as a result of their lifestyles. Many people in the United States don't exercise enough. They eat unhealthy diets. They smoke. They drink, whatever. But we see these things here, and we see that a lot of these diseases are chronic illnesses, and they are correlated with an individual's lifestyle. I'd also like to mention here, because I was talking about mental health earlier, the number 10 cause of death in the United States, unfortunately, is self-harm or suicide. So please, if you are struggling with suicidal ideations, please go ahead and seek help. There is no harm in that. As I mentioned, the life expectancy here in the United States is about 78 years. Women, however, do live a little bit longer than men. Sociologists look at that because the fact of the matter is they think that the way women and men, boys and girls, are socialized contributes to the fact that women are going to live a few years longer. Women are socialized to be taking fewer risks. They're socialized to reach out for assistance more than men. And a lot of this has to do with why sociologists feel that women live longer than men. As I mentioned, social class or social inequality is going to contribute to the health of an individual. The fact of the matter is the rich are more likely to experience better health. They have access to better nutrition. They're able to afford better quality foods. They're not likely to be eating on the dollar menu at McDonald's. They're also more likely to have access to better medical care. I mean, that's just the way it is. And I tell my students, if I go to the hospital with a heart attack and at the same time Bill Gates shows up complaining of chest pains, I ask my students who's going to get treated better. The fact of the matter is it's going to be the man who can donate enough money to build a wing to the hospital, and not the guy who doesn't even have enough to donate a feather. You understand what I'm saying? They're getting better medical care because they can afford it. They're also living and working in safer working conditions. That's just the way it is. Um, they are more likely, or I should say less likely, the rich, they are less likely to experience poor water quality like we've seen here in the United States in Flint, Michigan. If need be, they're able to go out and buy their drinking water. They're more likely to, or less likely to live in homes that are inadequately heated. They're less likely to have cleaner homes with sanitation issues, basically better health indicators all around than the poor people. I'll also mention in terms of infant mortality. Infant mortality here in the United States, it's twice as high for severely disadvantaged children in terms of socioeconomic status as for children that are born into privileged families. And to me, that is absolutely shocking and horrifying, but it is the case. And I will mention also that the poorest children in the United States are vulnerable to disease as at the rate of those that are in low income nations because they are experiencing much of the same things. The poor sanitation, malnutrition, unsafe water, and a lack of medical personnel. Now, here's where I get on my soapbox. If you are smoking cigarettes, you need to stop it right now. Tobacco kills 480,000 people every year from following the directions on the cigarette box. I will tell you that the first paper I ever wrote in graduate school dealt with the evils of the tobacco industry and how they get us hooked on cigarettes. They are just some evil people. And if you have any questions about how evil they are, reach out to me and I'll let you know. But 480,000 people die every year from smoking. That doesn't even include the secondhand smoke. The and I know there are people out there that say, well, smoking smoke. They don't believe that smoking kills people. Well, I don't believe that pizza makes me fat, but unfortunately it does, whether I believe it or not. If anybody out there does not believe that smoking kills people, and I am saying this, I'm going on record here. I mean exactly what I say. Look in my eyes. If there is someone out there that believes that smoking does not kill people, that person is a moron because the evidence is there. So if you're smoking, please stop. Talking about eating disorders as well, particularly anorexia and bulimia. My first experience with anorexia came when I was about 8 years old, 9 years old, and a singer by the name of Karen Carpenter developed anorexia. Unfortunately, she passed away as a result of that. Anorexia is the belief that you are extremely overweight, even when there is evidence to the contrary. And if you take a look at some of the pictures, if you Google some of the pictures of Karen Carpenter, you will see that what anorexia does to a human body. It is absolutely horrible and horrifying to witness. And I'll go to bulimia in a minute, but I just want to let you know, I blame the media for a lot of these eating disorders because they contribute to the myth that women are only beautiful if they're skinny and look like Barbie doll. The fact of the matter is, Barbie doll does not really exist. She's a myth, and it's caused so many problems in our society that it's just absolutely insane. Women that think that they're obese and whatnot when they're not. It's disgusting, and it really hurts me to see that take place. Bulimia is another eating disorder. Bulimia is where you will eat a large amount of food and purge it very quickly, meaning you will either make yourself throw up or take laxatives to use the bathroom so that you do not maintain the calories. And this causes its own problems as well. I've actually taken courses on eating disorders and addictions and things of that nature. And this just absolutely blows my mind that people would do that to their bodies. And it hurts me, especially when I see young people doing that, young ladies doing that to themselves. Ladies, love yourselves. And if someone likes you for who you are, that's great. And if they don't like you, they're not the right ones for you. Okay. So, and obesity here in the United States, about 64% of the people are overweight. I will mention that I don't like the way that the BMI calculates obesity because the BMI does not take into account bone structure. It doesn't take into account the differences between men and women. It doesn't take into account the differences between muscle, which weighs more than fat. If you actually look at the BMI, Arnold Schwarzenegger and Lou Ferrigno from the 1970s, the bodybuilders of the 1970s, would be qualified as obese, and that is absolutely not the truth. Now, having said that, I'm not saying that we don't have a problem with people in our society that are overweight, and being overweight contributes to a lot of health problems. It contributes to a lot of health problems with heart disease and diabetes and things of that nature. But the fact of the matter is this: the BMI is not the way to calculate that. I will also mention that the obesity in the United States is correlated primarily through an individual's lifestyle. Certainly, there are some genetics that are involved, but it has a lot to do with individuals' lifestyle. People that don't exercise, people that eat the wrong foods, and so on and so forth. So just be aware of those things. Now we're going to be talking, and I hope I don't offend anybody here, we're going to be talking about sexually transmitted diseases. A couple that are listed here, these are certainly not the end all be all. Gonorrhea and syphilis. Gonorrhea and syphilis are treatable. You can treat gonorrhea and syphilis with penicillin. HIV, which will eventually turn into AIDS, you cannot treat. It cannot be cured. However, I say you cannot treat. HIV can be treated, but it cannot be cured. Once an individual has HIV, they are HIV positive for the rest of their lives. I will mention that 2020 HIV, at least here in the United States, is no longer a death sentence. When HIV first came out, and AIDS was originally called GRID. It was called GRID, standing for Gay Related Immunity Disorder. There was a great deal of stigmatism towards individuals who had or developed AIDS, which was unfortunate. There was not a lot of sympathy for people who were dying of AIDS. In fact, if you want to see that for yourselves, you can take a look at the documentary "How to Survive a Pandemic" that was made dealing with the AIDS crisis in the 1980s. And eventually, what happened was there was a 7-year-old boy, or excuse me, a 10-year-old boy by the name of Ryan White who contracted HIV, contracted AIDS through a blood transfusion, and died as a result of it. And then, and only then, did politicians and the rest of society start showing concern for individuals who had contracted HIV. A lot of people wanted to blame an individual's lifestyle for contracting HIV and not showing them the sympathy and the compassion that they deserved. And as I mentioned, thankfully now HIV is no longer a death sentence, whereas it was back in the 1980s. People can live a relatively normal lifespan, provided they are taking medication. The problem with HIV now is in low-income countries across the world where they do not have access to this life-saving medication. So just be aware of that. Two questions you need to ask yourself. What constitutes old age? What does it mean to be old? And so help me, if you say 45, I'll flunk the entire class because I'm not old. I'm experienced, but I'm not old. We ask ourselves, what constitutes old age? What constitutes old age? We also ask ourselves why we fear getting old, because a lot of people do. We do. We fear getting old, and a lot of people fear getting old for a lot of reasons. A lot of people fear getting old because they're unable to do what they used to do. They're unable to move with the mobility that they have. Maybe they're afraid of dying, and we'll talk about death in a minute. But what constitutes old age? Fact of the matter is, there are many people that are 70, 80, 90 years of age that are much more active than I was in my 30s. So it's not just a number. You can't quantify old age, at least in my opinion. Some people think you can. I mean, trust me, when I get 65, I'm definitely going to take advantage of the senior citizens discount. But the fact of the matter is, I don't think I'll consider myself really old. I'm still a kid at heart. What it means to die. Dying means that an individual's completely unresponsive to stimuli. They have no heartbeat, no brain activity, and things of that nature. They are gone, and it is irreparable. It's they are not able to be revived. And a lot of people fear dying because it is the great unknown. And the sociologists out there, there are sociologists who focus on death as their topic of expertise. So, I also want to mention that not only are we getting older every day, but our society is too getting older. And we are seeing a graying society, and we'll talk about that in a minute. But I will mention this thing called ageism. Ageism is the discrimination against people, predominantly over the age of 40, in the workforce. The belief that old people cannot do as good a job as young people. And I don't believe that at all. I will take someone with experience any day of the week. But as I mentioned, our society itself is getting older, not just us as individuals. And the reason is because, and you can tell I'm a Simpsons fan here, because I had Grandpa Simpson on this one, and I got Patty. It says Patty, yeah, I think. Can't tell if that was Patty or Selma. There are two reasons that society is getting older. People are living longer. That technology that I was talking about, the life expectancy is going up. And there's also fewer children that are being born. Did you know that? Fewer children are being born. The reason fewer children are being born is because children are expensive. It takes, from what I've heard, it takes about $1 million to raise a child from birth to 18 years of age. And that is an expensive investment. Back in the day when people were living on farms, when there was no such thing as Social Security, it benefited people to have as many children as possible so that they could be taken care of in their old age. Those children were their Social Security policy. Do you understand? Those children were their farmhands. But now that people aren't living on farms anymore, and now that people have Social Security, and now that people are working well into their retirement age, we don't see, and I hate to say this, this is a return on an investment here. We don't see children as being necessary. So we're seeing fewer children being born. Um, you're going to have to bear with me on this one because this one sort of gets me a little bit agitated and a little bit hot. I'll try to keep it as calm and as cool as I can. Elder abuse and neglect absolutely drives me up the wall. If I see somebody abusing an elderly person, I'm going to get very, very, very unhappy. Um, but for the purposes of the exam, you need to understand the difference between abuse and neglect. And the difference is very simply intent. If we're talking about abuse, we're talking about individuals who are intending to mistreat someone. It is willful mistreatment. Whereas neglect, it is failing to do what you are obligated to do. You fail to perform an obligated duty. Abuse is that willful intent. Now, the fact of the matter is, I was reading an article and it said that there are about 3% of elder abuse and neglect cases in the United States. But you need to keep that figure in mind and take it with a grain of salt because there are a lot of individuals who are elderly who may not report being abused. They may not report being abused for a variety of reasons. They may be scared to report the abuse. They may uh, they may not understand that they're being abused. They may feel compassion for the person that's abusing them. Whatever the reason, those numbers are not reflecting all of the elder abuse and neglect that are out there. And I should mention that to you. It's very important because there are some people out there that, for whatever reason, are going to abuse elderly people. These are generally people that have elderly people in their control. The elderly people are dependent on them for some reason. These caregivers are probably overworked. They don't have access to resources themselves, and they may feel that these Elderly people are a burden on them in some shape, form, or fashion. Abuse can take many forms. It can be physical, emotional, verbal, financial, sexual. So just be aware of those. Just be aware of those things when it comes to elder abuse. Let's talk about the right to die. Euthanasia means euthanasia refers to assisted suicide. The literal translation here is good death, and it refers to assisted suicide. You are helping someone who is terminally ill. You are helping a person who is terminally ill in their life. And here in the United States, that is a um, uh, big topic. That's a big ethical topic. And a lot of people out there, some people support it, some people don't. And I see arguments on both sides. Other countries across the world, euthanasia is accepted, but here in the United States, it's a gray issue. Um, be aware also of the living will. Living will is a notarized document that states or stipulates the type of health care you wish to receive in the event that you are unable to decide for yourself. You're unable to respond. So if you are in a coma, this notarized document would determine what type of health care you would get. When I think about a living will, I also think about something called a DNR, a do not resuscitate. So if you signed a DNR and you have a heart attack, they're not going to try to save your life. And last but not least, here is hospice. Hospice is medical care, but the medical care that you receive in hospice is different than the medical care you would receive in a hospital or a medical setting. In hospice, they are not focused on curing your condition. They are not focused on saving your life or prolonging it. They are focused on making your last days as comfortable as possible. Um, just wanted you to be aware of that. Hospice is a very, uh, it's a calling. That's all I can say is it is a calling. And my experience with hospice and the hospice nurses that I've seen and worked with and dealt with have been absolutely the best of the best. It's a very emotional job from what I'm told, but it is a very rewarding job. So just be aware of hospice as well. And that is all that I have for this PowerPoint. And I will see you online if you have any questions.